Let's talk about diseases of the lower respiratory tract. Remember, the upper respiratory tract is from the trachea up. Now we're looking at the trachea down, specifically asthma and COPD, and within COPD, emphysema and bronchitis. Bronchial asthma is the recurrent and reversible shortness of breath, SOB. Now, point of fact on the abbreviation SOB, that is no longer an acceptable abbreviation to be used. For the simple fact is, if you describe a patient as being SOB, and you put that in their charts, and the patient, if they request their charts, they'll see that. They may not know that means shortness of breath. Okay, so that's why it's no longer appropriate to use that abbreviation. But asthma occurs when the airways of the lungs become narrow as a result of four characteristics: bronchospasms, inflammation of the bronchial mucosa, edema of the bronchial mucosa, and production of viscid mucus. The classic symptoms are wheezing and difficulty breathing. Other symptoms are cough, anxiety. Those are the big ones. And the cough tends to be like a barking cough. Chronic bronchitis is continuous inflammation of the bronchi and bronchioles. This occurs often as a result of prolonged exposure to bronchial irritants, working in an area with fumes, dust, smoke. Emphysema is airspace is enlarged as a result of the destruction of alveolar walls. The surface area where gas exchange takes place is reduced, and effective respiration is impaired. Now I want to point out something here. Effective respiration is impaired, but not ventilation. There is a difference between ventilation and respiration, and if you don't remember that, real simple. Ventilation is simply moving air back and forth. You breathe in and out, air moves back and forth, you're ventilating. Respiration is gas exchange within the lungs. So this affects respiration. Asthma affects ventilation. So there's a big difference there. Some of the respiratory medications we'll be talking about are going to be bronchodilators and anti-inflammatories. So what's the best way of treating asthma? What does evidence show? So we're going to talk about managing asthma. Everybody, if you have asthma, you should have an asthma action plan, and that action plan is based on the significance of the current symptoms, and it can start with short-acting beta-adrenergic, and then you're going to start off with inhaled steroids, and you just keep going up and up and up until you end up with high-dose inhaled steroids and oral corticosteroids. So come back and we're going to talk about bronchodilators and respiratory agents.